Talk. In today's topic, we will be focusing on hypertension and heart disease. Our guideline for hypertension or heart disease can be found in our ICD-10-CM Coding Guidelines under Chapter 9. So our ICD-10 General Coding Guideline states hypertension with heart conditions classified to I50- or I51.4 through I51.9 are assigned to a code from category I11, which is hypertensive heart disease. Use additional codes or codes from category I50, which represents heart failure, to identify the type or the types of heart failure in those patients with heart failure. The same heart conditions, again in category I50 or I50 through I51.4 through I51.9 with hypertension are coded separately if the provider has specifically documented a different cause, sequenced according to the circumstances of the admission or the encounter. Our guideline further states that the classification presumes a causal relationship between hypertension and heart involvement and between hypertension and kidney involvement, as the two conditions are linked by the term with. In the absence of provider documentation explicitly linking them, and unless the documentation clearly states that the conditions are unrelated, we are to link the codes together or not together. So for hypertension and conditions not specifically linked by relational terms such as with, associated with, or due to in the classification, the provider documentation must link the conditions in order to code them as related. So in other words, if those terms are missing or if it's not easily inferred that these conditions are linked or caused by another condition such as hypertension with heart involvement or kidney issues with hypertension, we're not to assign the ICD-10 code that correlates or combines those codes together or those diagnoses together. In our first coding example, we have our patient who presents for management of hypertensive heart disease with heart failure. In our first book step, we're going to identify or locate hypertension or hypertensive in our index volume of our ICD-10-CM manual. And so when we go to hypertension, we see that the description further states hypertensive. We have accelerated, benign, essential, idiopathic, malignant, and systemic, all that are pertaining or falls under the category for hypertension. Again, then we also drill down further because we're looking for hypertension or hypertensive with heart failure based upon the patient's diagnosis. Or some coders may take the approach of going to disease first, then drilling down to hypertensive, and then hypertensive guides them to hypertension. So it's just an additional step that's going to take you back to our first book step of hypertension and then proceed from there. So hopefully, whether you choose the first book step or the optional book step, our ICD-10-CM code should be I11.0. So once we go to I11.0, there's an additional coding notes, which states that we are to use the additional code to identify the type of heart failure. And it also gives us the category in which we should be looking to determine what that ICD-10 or our additional ICD-10 code should be for heart failure. So in our case, our doctor did not specify the type of heart failure. So when we go to our second book step, we're going to identify or locate failure, then we're going to drill down to heart. And so our ICD-10-CM code for this particular heart failure should be I50.9. So in our rationale, again, our patient presented with hypertensive heart disease with heart failure, and per the coding guidelines, we are to assign an additional ICD-10-CM code to identify the type of heart failure. And based upon the patient's diagnosis, the coder should assign primary code I11.0, which represents the hypertensive heart disease, and then secondary code I50.9, which represents the heart failure as unspecified, again, as the provider did not specify the type of heart failure for this patient. So again, our code should be I11.0 and then I50.9. In our second coding example, we have a patient who presents for management of hypertensive heart disease without heart failure. Again, so in our first book step, we're going to go to hypertension in our index. And again, it gives us the different codes or different descriptions or diagnoses that fall under hypertension. Again, the patient doesn't have heart failure. So, or again, we can still apply that other optional approach, again, starting with disease and then drilling down to hypertensive and then further drilling down to hypertension, which again will put us back at our original book step of hypertension. So our ICD-10-CM code should be I11.9. And our rationale for this, again, our patient presented with hypertensive heart disease. However, the patient did not have heart failure. Therefore, an additional ICD-10 code should not be assigned. Again, there aren't any other diagnoses to assign, as the primary ICD-10-CM code covers the patient's diagnosis, which is really just hypertensive heart disease. Therefore, the coder should only assign ICD-10 code I11.9. So in our coding tips, we want to ensure that we're capturing the entire diagnosis or entire diagnoses. So in our first coding example, the patient had hypertensive heart disease with heart failure. And in our second coding example, the patient simply had hypertensive heart disease. We also want to ensure that the two codes or the two diagnoses doesn't have a causal relationship, as in the provider's documentation did not specify that it was with or without or due to. In our second tip, we want to pay attention to the ICD-10-CM Coding Guidelines or those additional or inclusion notes located in the tabular list when we're locating our ICD-10 codes in the back. Also, remember to code to the highest specificity. Regardless of what coding guideline you're applying or following, you always want to make sure that your ICD-10-CM codes are coded to the highest specificity. And of course, when in doubt, always reference your coding guidelines or query your healthcare provider. This concludes our segment of Code Rhetoric with Tam Talk. To learn more, please subscribe to our YouTube channel at Abraham Medical Coding Coach Abraham, or visit our website at www.abrahammedicalcodingcoachllc.com, and be sure to follow us on Facebook, LinkedIn, and Instagram. Thank you.